Simple malaises in elderly people at home and first aid remedies. Elderly people often face simple but common health problems at home. As caregivers, family members, or even neighbors, it is important to recognize these malaises early and provide first aid while waiting for professional care. Let us go through some of the most common issues, one by one, with their remedies. Number 1. Dizziness or weakness. This is one of the most frequent problems among elderly people. It can happen when they stand up too quickly, when they are dehydrated, or if they have low blood pressure. At times, it may even be a side effect of medicine. If dizziness occurs, quickly help the person sit or lie down to prevent falling. Offer water slowly and ask if they have eaten. Sometimes, skipping a meal can trigger weakness. If dizziness does not go away or happens too often, it is important to consult a doctor, because it may be a warning sign of something more serious. Number 2. Minor falls or bruises. Falls are one of the biggest dangers for the elderly because their bones are often fragile. A simple slip on a wet floor can lead to a fracture. If an elderly person falls, do not panic. First, help them sit up slowly and check if they are fully conscious. Apply ice wrapped in a clean cloth to any swollen area for about 15 minutes. This reduces pain and swelling. But remember, if they cannot move, if the pain is severe, or if you suspect a broken bone, call a doctor or take them to the hospital immediately. Number 3. Headache. Headaches in elderly people may come from stress, tiredness, dehydration, or even eye strain. Sometimes it may be caused by high blood pressure. The first aid is simple. Allow them to rest in a quiet room. Give them water to drink, and check if they need to eat something light. If you have a blood pressure machine, it is a good idea to check their pressure. A sudden or severe headache should never be ignored, because it could signal a more serious condition like stroke. Number 4. Shortness of breath. Breathing difficulty can be frightening, both for the elderly person and the caregiver. It may be due to asthma, lung problems, or heart conditions. First, sit the person upright, never lie them down flat, because that makes it harder to breathe. Loosen any tight clothing and encourage them to stay calm. If they have an inhaler or oxygen at home, help them use it. If their breathing does not improve quickly, or if they start turning pale or bluish, call emergency services without delay. Number 5. Minor cuts or bleeding. Older skin is thin and tears easily, so even small accidents can cause bleeding. The first step is to wash your hands, then clean the wound gently with clean water. Apply pressure with a clean cloth or sterile gauze until the bleeding stops. Cover the wound with a simple bandage. If the bleeding is heavy, continues for more than 10 minutes, or if the cut looks deep,